Kadang-kadang saya lihat orang memberi pensel langsung mati. 2 minit, 5 minit, because of pencil sensitivity. But if you do the test and if it becomes red, merah atau apa lebih besar, we know it's sensitive, give another drug. So evidence-based medicine says, if PST is positive, this is the alternate drug of choice. Erythromycin, tetracycline, cephalosporin. Evidence-based. Now, menurut saya hanya penicillin, Pak. Okay, menurut Anda, kedua? Tidak ada. But evidence-based tells you 1, 2, 3, 4. So this is why we are moving more to evidence-based medicine. Okay? But still, in Gajah Mada also you will hear, doctor, in my practice we do this. Okay, no problem. Everybody bosan, you want to take 5 minutes rest? Mungkin sakit terlingga sama bapa dia mau cakap-cakap. Or shall I continue? Continue going? Yeah? Yes? Apa dah? Sama India ya? Woi, Anda mau air? Mau atau tidak mau? Ya, ini apa? Ini apa? Tidak ada orang India dari sini? Ada? Punjabi. Oh ya, Punjab dia betul. So I don't know sama kuda ya. You ask kuda apa Anda mau? Okay. So please, when somebody asks you, be bold, be talking. Okay, talk loudly. Next time when I come to take classes for you, I divide into 2 classes. And then I ask you to debate between the 2 classes. Then I ask the leader to come and stand in front of me and give the lecture. This is training in Gajah Mada. Why do I come to Gajah Mada? Because I enjoy teaching. I don't enjoy teaching University of Indonesia. I enjoy teaching in Unhas, Erlangga, and here. Because why? We teach practical medicine, evidence-based medicine. We teach you to become strong. So you can come like me and talk. Don't need slides. It all comes from your head. Okay? So this is what I want to show to you today. Becoming a good doctor, patient doctor who listens, but who also can explain himself. Meow, meow, meow. Like kucing, malu-malu kucing. Okay, sama. Okay. Nantuk. Jam berapa tidur tadi malam? Yeah, okay. If you read Al-Kitab and if you read Al-Quran, Adam and Hawa also were sick. Yeah, Adam and Hawa, yeah. And Siti Nurlisa atau Siti Hawa. Abraham or Ibrahim, Maha, yeah. Ibrahim had Sarah, istri. Ibrahim 125 tahun, istri 100 tahun. Nah, bagaimana anak datang dari dia? Anak bisa datang? Bisa, 100 tahun. Oh, tidak tahu. Oke, nanti sudah selesai Anda tahu. So, Sarah merasa kasihan Abraham. Dia mengambil pembantu dia, sangat cantik, masih muda, dan memberi untuk Abraham. Abraham senang, dia oke. Langsung 1 tahun hamil. Wow. Ini apa ini? What do you say for miracle? Malikot is angel. Miracle? Mujazid. Okay, whatever. Miracle. 1 year later, God came to visit Abraham. And he said, Abraham, what do you want most? Anak. God knows he has anak. Nama Ismail. Yeah? Inside Sarah, ha 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 ha. Because dia tahu 100 sudah rahim kering, bagaimana anak. But Tuhan janji next year she will have a child. And child was born. Nama Ishak. Ya, betul. Sekarang tahu. So 100 tahun bisa. Oi, orang Muslim atau siapa Anda? Huh? Apa saya? What I said is correct or not correct? Yes, Sarah was 100 years when she had Ishak. Whatever. Above 60. Okay. 16 years was in Pembantu. Okay. Then the 2 children were playing. Ishmael and Ishak were playing. But the mother, Chimburu. No, that is Pembantu's thing. Don't play. Then she went to Abraham, Chimburu Churega, and said, Rachundi Tarlinga there. Chase this boy off. So Abraham came, told Siti, please take Ishmael and go. But before going, he gave food and Siti was walking in the desert, Gurun. Kada tiba-tiba, the first case of dehydration, Ishmael became very dehydrated, 5% dehydration without acidosis. And he was lying down like semi-conscious, setengah mati. Ibu, wah, karena ini anak saya. She looked to God. Oh God, you brought me out, you brought me in the desert. Apa this is? And God sent the angel and gave water for this boy. So first case of dehydration was in the Bible, Al-Kitab dan Al-Quran. Okay? So anyway, just to show you, this is why harus baca Google search. Banyak ada di sana. Diseases of the poor. Nanda saya dan apa-apa sakit? Pusing, just hanya pusing. Saya diabetes, 35 tahun dah. But kapan saya pergi keluar, saya lihat orang miskin, dia gatal di sini, cerewet di sini. Diseases. So kapan-kapan di history, we see poor people suffering from disease more than rich people. Rich people can afford immunisasi. Poor people cannot afford immunisasi. So orang polio. Ingat berapa orang polio? All poor people, not rich people. 90% poor people. So, diseases of the poor. Now siapa? TB datang ke dia dan saya atau datang ke orang lain? Orang miskin, ya? Overcrowding, staying in the same place, bad eating habits, spitting on the ground. But he knows, I know better, we don't have TB. Diseases of the poor. But now, sekarang, di Russia, Eastern Bloc Europe, TB is increasing. Drug-resistant TB dengan STD dan AIDS. Amerika Serikat dulu tidak ada TB, sekarang ada 10% kasus di rumah sakit TB, drug-related, drug-resistant. So, but now coming to, okay, let me ask one question. Everybody looks like sleeping.
The change.
Very good. So, give me an example of epidemic change of disease pattern. You heard one said disease, one said change. Can you think of any disease that has changed, or disease pattern that has changed? When you were a child, maybe you don't remember, was there AIDS? When did AIDS start? Kapan mulai? AIDS, epidemic AIDS. 1985. Okay. Epidemiological transition means change of disease pattern. Change from acute infectious disease to chronic disease. Let me catch the boy near the door. Okay? But you look very senior person. Okay. Berapa umur Anda? 21, 30, 31? No. 24. One cancer example.
Nasopharyngeal carcinoma?
Nasopharyngeal. Wow, he's very good. Can I have cancer of my hair? No. But there are cancer in the stomach which is called teratoma, which has hair in the stomach. Okay, be careful. Okay. Priority of disease in outpatient and in hospitals was upper respiratory tract infection, acute bronchitis, chronic bronchitis, apa saja. Okay? Acute gastroenteritis. What is gastroenteritis? Try. What is gastroenteritis? Gastro means stomach, enteritis means intestines.
It's like,
acute means acute. Yeah.
Like acute inflammation in bowel.
What's the disease called?
Like daily.
Diarrhea. Okay. Can we have vomiting, gastroenteritis? Acute AGE. Can you have?
Yeah.
That's how they present. Acute vomiting, diarrhea, and like Ishmael, dehydration. Okay? But now, 1980, 1990, 2000, 20th century, 21st century, I go to hospital now, Zainul Abidin Hospital, number one disease, diabetes mellitus, hypertension. Number 3, obesity. Sorry sir, 3 bulan saya. Number 4, chronic arthritis. Okay. Number 5, cancer. Anybody else can tell me what is now Java, Sumatra, Vietnam, India, what is the common disease happening to young people? Anybody? It's called NID, non-infectious disease. What is that disease called? Motor vehicle accident. Do you have a motor? You have a motor? Oh, daddy's not rich enough. Oh, no, rich enough, gave car. Okay, sorry, you have a motor? Siapa motor? You have. You put a helmet on? Next time I catch you without a helmet, denda, langsung, okay? I catch all my students, all nursing students come. I watch in the gate from outside with binoculars. Who's coming without a helmet? 5,000 denda. Put it in the thing. Because motor vehicle accidents kill. And then they give you otak goreng. Then your mother and your father and your brother has to take you in the wheelchair, has to carry you, has thing. So if you want to kill yourself, kill yourself. Dibunuh diri, kill you. Jangan bosan hidup and matikan orang lain. Correct? So motor vehicle accidents now has become very thing. And smoking. How about ganja? Oh yeah. Ada di sini? Di Yogyakarta? Tidak? Oh, bohong. Jangan bicara mungkin. Ada. Okay. All over the world, seluruh dunia. Recreational drug. Ganja. Okay. But unfortunately, the smoking part gives you what we call chronic obstructive lung disease or chronic emphysematous disease. COPD, chronic obstructive pulmonary disease. So just remember, increased disease of cancers, lifestyle diseases. Wow. Have to catch a modern person. And where do you come from?
My name is Dina. I'm from Jakarta.
Yeah, from?
Jakarta.
Oh, jauh dong ni. Anda perlu pasport untuk Jakarta. Okay. What is lifestyle disease? Jakarta has very good lifestyle. Banyak makan.
Lifestyle disease, cholesterol.
Loud. You got to be loud, clear, loud. Ada bahasa Indonesia, bahasa English. Apa saja?
Hyperlipidemia. No.
Hyperlipidemia. No? Help her out. One more disease. But write a letter for her also to demote her back to first year. You got to try. Okay. Lifestyle disease means your lifestyle. Harvard, for the first AIDS case, we called it the Lazarus syndrome because the little child got it from, he was thalassemia receiving blood transfusion and he got the AIDS from there, and they wanted to stone the person to death. This is America 1985. So I thought AIDS was American induced depression syndrome. Okay. Emerging diseases, anybody? Emerging diseases, I gave you some example of emerging.
Some kind of stroke.
Stroke? That's right. Emerging disease, what is the new disease now in hospitals? What are hospitals so scared? Ebola, somebody said Ebola. Anything else? Give me another example. Asian flu?
Yeah.
Read the newspapers, please. Emerging superbugs. Who's read about the Delhi syndrome? Oh, Punjab? Delhi syndrome? No. Punjabi from Malaysia. Okay, maaf. Film industry Punjabi. That is Indonesia. Okay. Superbug means infection, hospital infection that does not respond to antibiotics, to normal antibiotics. And people die. And this case was also transferred to Britain. They had the case there, superbug. Okay, just an example. Now coming to my health economics thing. Costs. Have you heard the term in English? Nothing in life is free. Tidak ada apa saja tidak bayar. Harus bayar untuk apa saja. No free lunch. Okay? So even if you have a girlfriend, you got to pay for her, correct? Costly. You have a wife, child, costly. Yeah? Betul. You as a son cost to your father and mother paying jajan. You come, they pay for his education, and then he says, "Mami, jajan, yeah." Tidak 30, sekarang 300. Betul? How much jajan do you get from your mother? 1 million. Wow. Huh? 30,000 a day. Wow, not bad. Still, SMA. SMP 20,000, SMA 30,000, kedokteran mungkin 500. How much your father gives you? Okay, AX, with AX. Bayar 20,000. Okay, simple. I come back now, 2014, I go to Aceh, similar bronchitis. I said, take X-ray. So I went to doctor, he gave me X-ray. 180,000. Wow, sungguh inflation. Dulu, pembantu saya hamil and operasi. Kapan dia pergi ke rumah sakit? Oh, ini dari orang asing, banyak uang. No, cannot deliver. Ini sakit itu harus operasi. Caesar section. Caesar section those days, 2 million for the doctor, 1 million for anesthesia, 1 million for neuro, 4 juta. 24 tahun sekarang saya pergi ke taman saya, dia saya sakit kepala Pak, pembantu saya juga hamil, kami kirim ke rumah sakit Pasar Minggu. Berapa uang Pak? 16 juta hanya untuk dokter main golf sore, malam datang dan operasi 14 juta di pocket, malam bisa tidur bagus. So the cost of care has gone up. Panadol, kapan saya datang tadi? 1,300, satu strip 4 obat. Sekarang saya mau Panadol 4,000 atau 6,000, 400 kali naik. Everything has gone up. You go to the doctor says, Pas Toko, I designing the hospitals. So I went to the Dr. Beda, orthopedic. Pas Toko, dulu ada orthopedic bed. Sekarang I want orthopedic arm. I want MRI scan. Pak, MRI scan ke cancer. For bone, bone cancer. Oh yeah. And then saya kalkulasi berapa uang? Arm, $2 juta. CAT scan, $4 juta. MRI scan, 11 juta. Sekarang PET CAT scan, 20 juta dolar, tidak rupiah, maaf. Atau 20 saya memberi untuk dia. And then I said, okay Pak, bagus, Anda mau itu saya beli untuk Anda. Berapa operating cost? Pas Toko, operating cost apa? Saya just belului pelayanan itu, apa? So dia tidak tahu. With the instrument comes operating cost, overhead cost, maintenance cost. Maintenance cost and overhead cost untuk satu machine, CAT scan machine, tiap bulan 200 juta. So dari mana? Ini uang tidak datang dari pocket, dari pocket dokter. Dia mau pelayanan, dia mau uang pocket dia. Dia tidak mau pikir sakit kepala, maintenance dan ini dan itu, training orang technician apa-apa, dia tidak mau tahu. So cost of care has gone because of improved technology. Dulu plain X-ray, fluoroscope. Sekarang ultrasound fluoroscope. Tidak 1D, 4D ultrasound. Oh, saya pergi ke Norway, International Hospital Federation, sama machine baru. So they asked pregnant lady, please, very safe, let us see. So saya juga mau pergi untuk lihat. Wow, muka, can see the features. And then when I looked at the eyes, mata juga warna bisa lihat. I said, wow. But then saya sedikit bahaya. Karena mungkin ini dari bapa lain warna biru dan bapa lain murni apa dia think so. Ya orang lain betul. Okay, so very bad to have ultrasound which you can see the color. So inilah cost is going up and up and up. Dulu if I want to see specialist in Jakarta, Pondok Indah, siapa tahu Pondok Indah rumah sakit? Jakarta, Mr. Jakarta. Hello. Pondok Indah? Ya, okay. Dulu 50,000 untuk specialist. Sekarang 550 untuk specialist. Satu visit. And dia juga halal. 3 minit 550. Okay? So jangan khawatir. Kapan ada dokter sama saya banyak uang. Okay, thank you. Drug cost. Saya baru bicara drug cost. Anti-cancer drugs. anti-cancer drugs. Sekarang, not less than 200,000 to 400,000 per tablet. New drug come out, new anti-cancer drug, 1,700,000. Now siapa? How can the poor people afford this? This is why we need safety net insurance program. Good question. Angkat baru. Lama.
Baru.
Askas.
Ask us. Help us. What are the insurance programs?
Jam Kesda.
JPKM, Jaminan, ask us, then Jam Sostek for thing. Now sekarang BGPS, JKN, JKR, JPM, Jam Bersal, okay. But very good social safety net untuk orang miskin. Siapa orang tidak bisa bayar, dia bisa masuk. Hospitalization, berapa orang di sini sudah masuk rumah sakit? Inpatient. Anda tahu berapa uang untuk satu hari? Tidak tahu. 300 low beds. Sekarang Anda pergi Pondok Indah, Miss Jakarta, Pondok Indah Anda pergi, jangan pergi Pondok Indah, banyak MMC ada banyak. Pergi di sana just hanya untuk ICU. What is ICU mah? Intensive Care Unit. ICCU apa? Cardiac Care Unit. PICU apa? Pediatric. And NICU? Neonatus. And HIC? High Unit Care, HUC. Sudah after operasi, post-operative, you come to high-end care. Okay, hospitalization di Rumah Sakit Zainal Abidin. 1993 pertama kali saya pergi di sana, 350 untuk satu bed satu hari dengan pelayanan kesehatan dan pelayanan nursing. Hari ini, kemarin saya lihat berapa harga unit cost, 2.950.000 sama 5-star hotel. Now Anda dan saya orang dua-duanya miskin, tidak bisa pergi di sana ya. Okay, tanpa asuransi. Investment cost for medical specialist. Let me catch somebody. First semester.
14,500,000 rupiah per semester. No, no.
Administrative fee tidak ada. No. Okay, very good. Batch student 3.300.000. Sekarang untuk S2 satu semester berapa? 18 atau 22 ya? Mahal. To the end. 280 Toyota. Okay, just hanya untuk comparison, study bunding, cash bunding. Di India hanya untuk masuk di college 300 juta. Masuk, ada nama administrative fee untuk pembangunan atau apa-apa saja. Tiap semester 66 juta. 8 semester lihat berapa. So, is your father okay for that kind of amount of money? 1 miliar? No, but you said okay, you got motor and everything. Sell the motor, you will only get 14,000. Okay, 14 million. So inilah just hanya pikir. Ini wang tidak datang dari beasiswa. Harus bapa dan ibu harus cari untuk Anda. So just think how much you owe your father and mother. Okay, please, because they're going through a lot of difficulty for you. Bapa ibu saya juga, every time when I got to medical college, telegram datang, Pas Toko selected to come for interview. So ibu was having baths. I running bath. Ibu, I got the thing. Diam. Ibu, apa? Alive dah jatuh apa? Mati. Then dia datang and then menangis. I said, Ibu, be happy. I got into best medical car. Pa, kami pensiun. Tidak ada wang. Dari mana wang untuk Anda? Inilah saya menangis. I said, jangan, just doa untuk saya dapat scholarship. Dan sungguh, terima kasih Tuhan, saya dapat 2 scholarship. Satu beasiswa saya memberi untuk dia, dan satu beasiswa saya hidup. So, kadang-kadang sama itu. So investment. Now specialist di Unhas, OBGYN anda mau pergi, just hanya untuk masuk untuk department charge hampir 800 juta. Oh ya, di India 5 miliar. Radio imaging 10 miliar. Mengapa? Ada 5 tahun ada wang datang di pocket dia. Competition, private sector. Mengapa cost mahal-mahal? Karena banyak rumah sakit swasta sudah Ibu Jakarta. How many private hospitals in Jakarta? Do you know? Berapa jumlah swasta, rumah sakit swasta? Tidak tahu. Hanya tahu rumah sakit Pondok Indah. Hampir 100 rumah sakit swasta. Okay, super specialization. Okay, di sini silakan. How many people want to become specialists after GP? Berapa orang specialist? Wow, 90%. Berapa orang mau super specialist? Berapa orang mau public health? Oh, satu. Yo, what's your name, Frita. Imida. Indra. Okay, congratulations. You're like me. Anybody? You also want to become primary health? No, put the hand down. Who wants to become a hospital director? Orang tidak mau responsibilitas, tidak mau sakit kepala. Okay, bagus. Who wants to become a rehabilitation physiotherapist doctor? Tidak ada. Who wants to become an orthopedic doctor? One. Male or female? Oh, male. Is good for cutting, yeah? Okay. OBGYN? OBGYN. Only one. Obstetric gynecology. Banyak wang dong obstetric gynecology. Ya, karena semua wanita mau hamil, so harus pediatrics. Only one, two. So semua orang 90 specialist, apa specialist anda mau pergi? Beda? One, female. Anda tahu berapa wanita di dalam department beda? Lihat di Sajito. Mungkin 1, 2. Hati-hati, di college saya juga 1 wanita di batch saya, 60 orang beda. So apa specialist apa dia mau? Specialist keuangan atau specialist IT ya? Oh, okay. Tidak apa-apa. Natural man-made disasters. Siapa ingat 24 Desember 26 jam 8.10? Apa itu? Tsunami. 9.2, one of the heaviest earthquakes in history, hit Aceh. Anda tahu berapa orang meninggal? 250 untuk seluruh dunia. 166,000 orang. And pengungsi 550. Hilang 200. Okay? Interesting story. Saya pergi ke Maldives. Tahu Maldives? Pulau Maldives? Hampir 5 jam dari sini. Dulu ke Singapore ke Maldives. Dan kami tsunami presentasi dan satu orang, Pak, Anda dari Aceh? Saya said, ya dari Aceh. Pak, ini Pak KTP. KTP, ya korban kami dapat di sini. So korban dari Aceh sudah ke Maldives. Ya. Wave height 130 kaki. Speed of the wave 550 km per hour. Sama jumbo jet. Okay? So saya hari ke-15 sungguh lihat parah. So inilah saya sedikit dedication untuk bantuan orang Aceh. Okay, factors affecting health. Hari ini topik global doctor. You in a global. Global means seluruh dunia. Hospital without walls. Healthcare center without walls. Come to you, last person. What is the organization? Foreign organization.
WHO.
WHO. Another organization. Private. Okay. It's a French organization called Doctors Without Borders. Tahu? Tidak tahu? Dr. Le François? Yeah? Men? Correct. Please, go home today, open the Google and look for Doctors Without Borders. Please read about what work they do. baru di Somalia dia tembak doktor di sana, 22 orang mati. Okay, so be careful. Di sini juga. Oh, an Indonesian doctor. Care without barriers. I mean, siapa saja datang ke rumah sakit Anda harus ada nama access to equitable care. Doctors without frontiers, FK-KMK, now 1 tahun lagi doktor dari Filipina, doktor dari Singapore, doktor dari Kuala Lumpur bisa praktek di Indonesia. So lihat, sekarang kompetisi untuk Anda. Nanti sikap tidak bagus, praktik tidak bagus, orang mengambil. Brain drain. Can't get this work. What is brain drain? Anybody? Brain drain. Banyak orang doktor di sini and then pergi keluar untuk kerja. Nursing. 60 nurses training di Indonesia, kerja di Brunei, kerja di Malaysia, kerja di Singapore. Ini nama brain drain. Economic zones attract skilled workers. So mana ada wang? Saudi Arabia. Lihat contoh pembantu KTW. Okay, what is it? Foreign workers, KTW, TKW. Okay, maaf. Okay, berapa orang? Semua lari-lari Hong Kong, walaupun dia pukul dia bunuh dia, masih pergi. Karena economic zones, where dia, mana gula ada, simut akan datang. Okay. Globalization healthcare. Okay, contoh saya. Medical education, doctor di India, practice di India, Saudi Arabia, teaching di Australia, sekarang saya teaching di Monash. Siapa medical Monash, University Monash? Monash, nobody heard of Monash. James Cook. Orang tua medical Monash, nomor 1 university di Australia. Mungkin nanti untuk Anda mau pergi ke specialization, Monash. Okay? Consulting in Indonesia, treatment in Malaysia. Okay, medical insurance from Germany. Oi, potong deng, stop your. Just hanya ini global doctor. Nanti Anda juga mungkin global doctor. So ini contoh untuk satu orang, but global thing. Now ini untuk Anda. You as medical students, high demand for skill based. Semua orang mau kembali investasi. Your mother and father paid for you, you want to get that money back. Okay? So don't tell me I want to be work for the poor, I want to be a good doctor. Anda minta sekarang apa saya? I want money. Mau uang dulu. Money talks, bullshit walks. Okay? Remember. Everybody wants to be a specialist. Lihat, 99% mau specialist. Orang tidak bersama saya, health services management, medical director, primary health care. Orang tidak mau, ya? Okay. But don't worry, banyak wang dari health services management. So jangan pikir wang kecil, wang besar juga. Everybody wants to be head, director, chief of department. But di kelas di sini orang tidak mau director, tidak mau chief of department, hanya mau specialist. Okay, nanti mungkin tahun ke-4 Anda mau. Medical students rights to quality training. So kapan Anda memberi wang ke Gajah Mada? My duty is to give you the best education. But you have to open your ears, you have to open your mind, and you have to accept it. Because you paid money, paid good money. So ini nama, Jimmy is my name, and give me is my game. Nama saya, memory untuk saya, okay? Changes in medical education. Mengapa Anda datang ke Gajah Mada? Karena ini paling penting untuk saya. Classical lectures dulu didactic, saya just duduk di sini, I tell you, I don't ask for input. Discussion sekarang Anda lihat room 1, room 2, room 3, 15, what we call round table discussions, case history, okay? Case history, problem identification and solving, evidence-based medicine, skills training. Sekarang saya lihat skills training ada. Sekarang di University Monash saya virtual reality training. Saya tidak usah pergi ke anatomy, operating on the dead body. Ada body di depan saya, virtual body, and I can dissect. Sekarang surgical skills juga ada di sini. So saya mendengar University Indonesia mungkin dapat satu sistem. So saya tidak tahu kapan UGM dapat. And ini learning via internet and search engines. Hari ini siapa tahu Profesor Laksono? Mendengar suara? Profesor Laksono, Head of Department, dulu sekolah kedokteran S2, S3. Oh, next year they will do. Okay. Dia orang. Okay. Now he has invited me di Aceh, Kamis jam 1 lecture di sana, and it will be via internet to the people here. Okay. So that is via internet. Characteristics of a global physician. Silakan mendengar, saya baca, ability to handle medical condition. 5 tahun sudah selesai, you must be able to handle 16 kasus biasa. How to do basic surgical skills. How to take a case, obstetric case. How to do advanced cardiac life training. So ini skills anda dapat, okay, sebelum anda pergi. Address changing epidemiology. Please change your practice. Think more now diabetes, hypertension, hypercholesteremia, cancers, motor vehicle accidents. Evidence-based medicine, cost-efficient doctor. Jangan 5 prescription. Untuk flu just 1 Panadol atau sedikit Benadryl cukup. Jangan 5 medicine, jangan suntik apa-apa. Okay. How to improve your approach to learning? Patient, sabar, mengerti, understanding, attentive, good listener, good communicator. Okay? Recorder. Please record all your things that you keep in mind, and then the night time please read it. Respect for the patient. Saya lihat di mana Pak? Aceh. Kapan orang kaya datang di Mercy dan apa? Oh Pak, please sir, please sit here. Please sit. Orang miskin datang sedikit bawah. Hoi, pagi datang di belakang, duduk di sana. Ini sikap apa? Ini sikap dokter? Saya tidak mau mendengar ini dari anda, okay? Make me proud that I'm your teacher. I taught you how to improve your sikap. Respect the motto. Ini di seluruh agama. Cinta Tuhan dulu, and then cinta manusia dekat anda sama cinta anda. Love thy neighbor as thyself. Kapan ini sikap ada di dalam anda, you will treat your patient well. You don't have to worry. Okay? So today, while you go, at least learn this one thing. What is to be a good physician and how to respect your patient. Competency-based practice, professional clinical manager. Okay, this is just joking. Please, this is a very nice thing. Bagus hidup Anda bisa lihat. Mungkin lilin hidup dan Anda di bawah kursi atau di bawah orang tidak bisa lihat. So a good physician is a candle that can be seen seluruh dunia. If A, B, C, D, if A equals 1, C equals 25, apa? What is hard work? Lain nanti UGM saya mau sangat bagus dokter. So hard work berapa counting? Karena saya economist, just financial orang. A 98%, ya bagus. 2% inspiration, 88% perspiration, keringetan. Okay. Knowledge, Anda pikir ilmu sangat bagus? Lihat berapa. Kalah, okay, saya juga kalah, 78. Love, you got Pas Toko bicara love my labor, love my thing, love my, but berapa harga? 50%, itu cukup. So apa-apa saya sama Harmoko, hari-hari omong kosong. Okay. Luck, luck, 47%. Most of us think this is most important. Banyak orang, saya juga pikir love is very important, respect is very important, but let us find out what is really important. Every problem has a solution only if we perhaps change our ganti sikap kami. To go to the top, to that 100%, really need to go further and a bit more. Attitude, sikap. Lihat ini. Wow! So, inilah hari ini. Silakan, just ganti sikap. Okay? Just change your attitude a little bit towards yourself, towards your neighbor, towards your patient, towards your teacher. It is our attitude towards life that work makes our life 100%. Attitude is everything. Who said these words? Don't ask what your country can do for you. Ask. Siapa bilang itu? John F. Kennedy, 1965, sebelum dia dibunuh dia. So, jangan answer what can you do for medicine? What can medicine do for you? Ask what you can do for the patient. What you can do for medicine. Think big, start small, start hari. Marilah mulai hari ini. Okay, paling penting. Thank you, UGM, for pleasure, for sharing with you. Good luck to all of you. And sebelum saya pergi, minta maaf, style saya sedikit keras. So, maaf orang di, I'm sorry I had to correct you, but good. So, minta maaf untuk itu. I only trying to bring out the best in you. Okay, so thank you again. Ya, maaf. 10 minit ada Pak, so question and answer time.
You said you were study at Harvard, so what's your reason to, not continue your practice there, but come back to India? And
Good question. Sikap America sangat jelek. Okay, everything there is money. So if I had to stay there, my mind would only be on money. Whatever attitude, sikap, cinta ini, cinta itu, cinta manusia, I would have lost that staying in Harvard. So I felt, maaf, agama saya Christian. I wanted to come to do missionary work in India and everything, so I came back. Yeah.
Okay, my name is Lintang. I'm pretty surprised. Yeah? No, Lintang. I'm pretty surprised that you are saying about hospital without walls theory. It is actually an interesting concept. As I know about hospital without walls is a theory about community development, which means the doctors are trying to be involved in the community to improve the nation's health. But as I knew in Yogyakarta that one of the hospitals already did that is Rumah Sakit Bethesda, that they are actually trying to be involved in the community. So, but I want to know more about what is hospital without walls.
But I'll give you a practical example. Hospital without walls. Rumah sakit tanpa dinding. It is like what you said, outreach activities into the community. Okay, contoh satu. Early diagnosis of cancer, cancer breast, cancer uterus, cancer prostate, can be done in the community. But we have the equipment in the hospital. So now for Aceh Hospital, I'm getting a mobile van, mammography equipment, so we can do it. Pap smear, we can do pathology immediately on the site. And then for cancer, chest, smoking towards smoking, we have cancer. So that is example outside. The other very good example is primary health care. Prevention. Stop smoking. Eat less salt, more exercise, drink a lot of water. Simple techniques, but specialists from the hospital can part it. Another hospital without walls, sending the specialists to help the primary health center doctors to improve their practice. High risk screening. Okay, third year you learn. Hypertension, diabetes, preeclamptic eclampsia. Okay, so we go to the doctors and teach them high risk screening. We also go down there with ultrasound, show them how to use ultrasound. But main thing is, we go into the community to teach nutrition, immunization, so we help posyandos, poskesdes, village clinics, and pustos. So that is example, but I fully agree with you, more and more modern hospital must use this out. So one of our contract with hospitals, you must have a department called outreach department. So okay. Anybody else?
I'd like to ask your opinion in how would you rate Indonesian physicians? Because as earlier you mentioned that there's a free trade coming up, and I would like to know in your opinion, how would we fare in the upcoming free trade?
You want an honest answer or you want a harmoko answer? Honest answer. I would say Indonesian basic physicians, family physicians are good. But the sikap, the attitude is not up to standard. The patient doesn't come first, they come first. So if they can put the patient first, and if we in Gajah Mada can teach you good protocol, good evidence-based medicine, you all can compete with anybody in this area. Specialist, we cannot compete against Singapore or anybody. Why? Alat changi. Very good treatment, very good education. Our education here very good for pediatrics, obstetrics, gynecology, better internal medicine. But when we go for subspecialty, okay, Chonto, one of my juniors, 10 years, he's doing robotic surgery. Dia duduk di keluar, theater, any patient is sitting, he's playing with it here and he's operating on the brain here. Now that kind of surgery we cannot do in India. I thought, so this is the kind. They're going inside the vein, placental vein, inside the stomach and repairing the heart of a child. We can't do that here. Can you imagine going through the vein, the umbilical vein, and operating and closing the heart of a child, of an infant inside the stomach? Stem cell research, okay, baru kami mulai stem cell research. Advanced. Cancers now, we are draining the immuno thing, putting new bone marrow into them, and they're surviving. 10 years, 15 years surviving. We have not got that. PET CAT scan, 15 tahun yang lalu di Amerika Serikat. Baru sekarang mesin pertama, Gleneagles Shalom. Miss Jakarta, Gleneagles Shalom di Bekasi, ada tahu? Okay, so ini Shalom.
Okay, I think that's last.
Okay, sorry, my guru is saying.
Maybe you have a closing statement, message for them for facing the future, the challenges.
Wow, kesimpulan. Very difficult to put all whatever I said. But I think the main thing is knowledge, improve your knowledge in Gajah Mada. We will give you the skills. Sikap, you're not born with sikap. You develop sikap dengan pengalaman. Change your sikap. Practice, there's nothing like pengalaman. Now saya sekarang 45 tahun praktek. So saya bisa bicara dengan pengalaman saya. So for that to reach, so my advice is, you come here, you got the opportunity, thank God, thank your parents, thank your teachers, make the best opportunity of what you got. Because remember, for each one of you students, there are 5 million students wanting to become a doctor and cannot become a doctor. Because tidak ada kesempatan, tidak ada wang, tidak ada opportunity itu dia. So you're all blessed, rezeki untuk Anda. So as far as possible, please take with you a positive attitude. Thank you.
Let's give a big applause.